The way the workstation is set up can impact stresses on your body, especially the low back and wrist. Organizational changes can be complicated and difficult to implement, but working with your station, you may be able to develop ideas on how to improve your work practices. Approaching the safety committee, training coordinators, and command staff with ergonomic ideas are effective avenues for making organizational changes. Personal protective equipment is lower on the ergonomic hierarchy. Ergonomic personal protective equipment promotes neutral posture or reduces forces to the body. Examples include lumbar rolls to keep your spine in neutral posture while sitting in the vehicle, doing paperwork, or reclining. During drills without live fire, knee pads could be worn to decrease the force to the knees, a joint prone to osteoarthritis. These are items that could be requested from the equipment committee. Finally, body mechanics is an option. This is the least effective protection from risk of musculoskeletal injury, but the one that you have most personal control over. Maintaining neutral spine while lifting, such as when you're lifting your air pack, rather than bending at the waist, is an example. Similarly, when raising a patient on a gurney, you should lift with your legs, keep the gurney close to your body, and your back in a neutral posture. The most important body mechanics concept for the low back is maintaining neutral spine. Remember to keep the three curves of the back, the cervical, thoracic, and lumbar curves. One way to practice neutral spine is to hold a straight edge against your spine. You should be able to slide your hand between your low back and the straight edge, even as you move. Proper body mechanics should be practiced in all your movements at work and not just when you are lifting heavy patients. This ranges from firefighting and patient handling to housekeeping at the station and physical fitness. Now that we have talked about the risk factors and potential ergonomic solutions, let's take a look at a few scenarios to practice ergonomic skills. For each scenario, think about why it is done this way, then identify the risk factors, come up with possible solutions, and discuss barriers to successfully implementing these solutions. These scenarios won't apply to all departments or all situations, but they present an approach for identifying problems and exploring ergonomic solutions. This first scenario depicts two people carrying a patient down a stairway using a small cot with handles. Why is it done this way? The risk factors are excessive force caused by weight of the patient, awkward postures associated with keeping the patient level, and twisting to see the stairs. A potential solution for a wide stairwell is using a backboard with 4 people, or the same cot with 4 people. An even better solution for most stairwells, wide or narrow, is a well-designed stair chair that places little stress on your body. This model is excellent since the patient does not have to be lifted and carried down the stairs since it rolls down the steps. It can also make the patient feel more comfortable and more secure. Examples of barriers to these solutions might be the lack of storage on the ambulance, or restricted funds for purchasing the equipment, or resistance to changing equipment and work practices. Are there other solutions or barriers? The second scenario demonstrates a firefighter rolling a hose during a training drill. Why is it done this way? The risk factors associated with this are awkward and prolonged postures to the back from flexing at the waist. Depending on the size of the hose, different techniques may be used that reduce the stress on the low back. For a 2.5-inch hose, the firefighter could roll the hose from a kneeling position, maintaining a neutral spine. For larger 4-inch hose, a combination of bending and kneeling could be used to reduce the time spent in each posture. The barriers could include the perception that it is quicker to roll the hose while walking in a stooped posture. Another barrier might be a knee problem that causes pain when kneeling. What might other solutions or barriers be? In the third scenario in the station, this firefighter is performing a routine check of the medical pack. Why is he doing it like this? The risk factors are prolonged and awkward postures to the neck, back, and knees. A solution might be to place the medical pack on a table or cart about waist height, to elevate the work and allow the worker to stand upright while checking the pack. Some potential barriers include space for a table in the bay, or the time it takes to get the table if it is stored, or walk to the table if it isn't near the vehicle. What might be other solutions or barriers? The final scenario shows a common exercise performed by fire and EMS personnel to strengthen oblique abdominal muscles. Why strengthen these muscles with this particular exercise? The risk factors to the back include repetitive twisting and flexing of the low back, which are awkward postures, and forceful exertion to the lumbar discs. Solutions include exercises such as the bridge, which keeps the spine in neutral posture while maximizing trunk stabilization, strength, and endurance. A barrier to using this exercise might include resistance to changing an existing workout routine. Can you think of another way to safely strengthen the obliques? And what are other barriers to adopting new behaviors? For ergonomics to be effective in preventing musculoskeletal injuries, it must be part of a comprehensive safety and health program. An ergonomics team can be part of the existing safety committee, which is the appropriate vehicle for creating change. Your role is to identify and prioritize risky job tasks, assess the hazards, develop plausible ergonomic solutions, and bring them to the attention of the appropriate committees. As a review, ergonomics is the relationship between the worker, the task, and the environment. It is fitting the job to the worker. Musculoskeletal risk factors include awkward postures, excessive force, repetition, impact force, excessive temperature, vibration. And remember, time, intensity, frequency, and combining risk factors increases the risk. The solutions in order of effectiveness are equipment or engineering changes, job organization and work practice changes, personal protective equipment, and body mechanics. Attention to ergonomics can help prevent injury, disability, and help you provide the best care possible to your community. The long-term benefits of ergonomics can prolong your career and enhance the quality of your retirement.